Thanks, Alex. While some of you are sitting cosily back in Manchester, I've come here to Darlington to find out a bit more about care in the home, and I believe there is a lady here called Val who can help. So tell me, how did you become involved with care in the home?
My role as a senior service manager involves me managing the team who then go and visit people on the wards. They visit people in their own homes. We make telephone calls. The services that we run are all about trying to get people back on their feet, giving them a little bit more confidence, giving them a bit of reassurance that actually there's somebody out there who will give them a hand when they get stuck. The aim of the scheme is to work with health and social services staff to help people get discharged from hospital, to visit them, help them with their shopping, make some snacks, generally help them to get back to everyday living.
How do you feel when you see the service users back on their feet?
The feedback that we get from themselves, from their families, from the professional teams that have been working with them, just makes it such a worthwhile job. And certainly from a volunteer's point of view, all I hear is, can I do more of this? This is really rewarding. I've had such a good day. It's very satisfying.
So that's what care in the home means in practice, but what about the impact for the people of Darlington? I think someone in here may be able to tell me. Councillor Copeland, how did you become involved in the service?
We were looking at new ways that we could support people both before they go into hospital and immediately after they come out of hospital. It's very important that they get that support so that they have a successful return home and remain independent.
How important is the care in the home service to the people of Darlington?
It's very important. It fills the gap between a lot of the professional services in providing that kind of low-level support, which often families have provided in the past. But with families being away from the town and spread out, it's good that we've got good volunteers who are well trained and bring in that support to people.
Do you have a message for the volunteers who help provide the service?
I would like to thank them very much for giving of their valuable time and bringing personal comfort to people, many people who have felt quite lonely and obviously very concerned about going into hospital, and the friendly face has supported them through that extremely difficult time.
Well, it's all very well meeting the managers and councillors, but much of the success of care in the home is down to the volunteers. Pauline and Hilary have kindly agreed to let me help them today. How does Claire benefit from the service, in the long run?
Well, she's going home now and she's had a short stay in hospital. So just when she gets home, we'll see that she settles into a home okay, and then continue the support until Claire decides, that she's confident and regained independence.
Do you want the kettle off? We're walking through together.
When they've come out of hospital, they're obviously feeling very low and perhaps tired, so they're disorientated. And to get back home, just seeing them maintaining their independence and remain in their home is something that we know we've done a good job with.
So what was it like before the Red Cross helped you?
I was stuck.
Yeah?
Yeah, I couldn't get out at all.
So
when I first came out of hospital, as I'm supposed to now, I couldn't walk. But they bullied me. They used to take me round the little square outside.
So not only did you get fresh air, you got exercise as well.
Yeah.
My day's not over yet. I'm off to Blackpool to see a different kind of care in the home service. See you in a little bit. Unfortunately, there's no time to see the tower. Places to go, people to see.
Come in.
Hi Julie, I'm Michelle.
Oh, hi. Pleased to meet you. Please sit down.
Can you tell me how you're involved with care in the home?
We're working on a new service. It's called Enhanced Discharge. We're working here at Blackpool Victoria Hospital with the Accident and Emergency Department and the Acute Medical Unit. And the whole idea of what we're doing is to get people home. We've discovered that it costs approximately £230 a night to keep somebody in hospital, just a rough estimation. If somebody has to stay because they have social needs as opposed to healthcare needs, for the NHS, that is really not a good idea. Hence, that's where our service comes in. We find that people, when we go over with wearing the Red Cross uniform, the Red Cross is so trusted that they visibly relax when we arrive at the side of the bed. I think top of the list of what we provide is reassurance and companionship in a time when people feel very small and vulnerable in a large, busy hospital. And we've not met one member of the medical staff that hasn't thought not just that it's a good idea, but that it's a fantastic idea.
One person who knows and appreciates the benefits of care in the home is Tina, emergency nurse practitioner here at Blackpool Victoria A&E department.
What used to happen was that the patient used to be discharged. We used to phone obviously the discharge team, who then put them on a list. They then had to wait hours for patients to be taken home. They were then have to be put into a hospital bed and then discharged in the morning, and possibly again with another long wait.
Is the service just for older people?
Mainly, but obviously there are other sort of disabled people that can't get home, that have accidents or injuries. So we do, allow for that as well.
Do you have a message for the volunteers who work on this service?
It's absolutely brilliant that we can access this service. It's made our life a lot easier, and also the patients find it absolutely brilliant.
I think it's time to find out a bit more from the people at the sharp end. How do you feel once you leave a service user?
Well, it's the old cliche, it has a real feel-good factor, and you really do feel you've made a difference. You go across to the hospital, you meet someone who's feeling very vulnerable, very upset, because they're very shaky because they've had an accident. And then once they see you, they say, "Oh, you're from the Red Cross? I know all about the Red Cross." And because our reputation precedes us, it's like they're meeting an old friend.
Another volunteer here in Blackpool is Alan.
I take people to the hospital. I take people for specialist treatment. I take people for cancer treatments. I take children, universities, whatever they ask me to do in the transport and escort side, I do. What I personally get out of it is I always wanted to help someone, and when you finish work, like me, coming out of the Royal Air Force, you have to do something, don't you?
How do you feel when you leave the service user at home?
I feel as though I've a job well done. That's what I really feel.
So that's my quick tour of care in the home, and I have to say I'm proud as a volunteer to know that the Red Cross are providing such an excellent service. And now it's back to you, Alex, back in cosy Manchester. Oh, and by the way, I brought a little something for you.